Okay, welcome back from our break. We have a second case study we want to share with you today, which features the Cool Street Project led by the nonprofit Ready Center. Their project provides summer heat relief for residents in Red Hook, a section of Brooklyn that was particularly hard hit by Hurricane Sandy. Let's see how they did it.
It's terrible, like really terrible. Like I hate being outside. The heat, it irritates me a lot. I have asthma and I can't really be in heat as much. So with less shade and more heat, I'm usually staying home.
17-year-old Odalis Perez has lived her whole life in Red Hook, a neighborhood in South Brooklyn that was hit hard by Superstorm Sandy in 2012. Today, she's working on a new neighborhood initiative called Cool Streets.
We're building benches for people to sit just because, the heat, and they're also trying to put something over it so it provides shade and provides air.
The idea behind Cool Streets is having community resilience through bringing together designers and community youth to build shade structures, water elements, to keep the community from suffering through the heat during the summer months.
So Cool Streets kind of came into our imagination because we started looking at COVID as an implicator for multiple disasters happening simultaneously. And, we're always thinking about the fall and the flood season, but heat is maybe even more important to address because it's a constant and it's just going to keep happening every year. Our temperatures are rising. We have really serious vulnerable communities that are going to be impacted.
Red Hook is home to the largest public housing development in Brooklyn, and renovations from Sandy are still ongoing. During construction, the city removed about 450 trees that previously provided shade for residents. The response to one climate crisis, hurricanes and storm surges, has inadvertently complicated another one, extreme heat.
It's hot, it's COVID, and it's construction. Those don't go together. With the parks being limited, it's not a lot of activity in the park, and they also cut trees that line the beginning of the park. So to sit there, it's like you're just right into the sun.
It's been really unfortunate with COVID. A lot of traditional cooling centers that are sponsored by the city in typical response to summer heat have been closed or are still trying to figure out how they can open.
Closure of the Red Hook pool, now a COVID testing site, is a disappointment to the community who saw it as an oasis in an otherwise urban heat island.
I have a heat gun, so a temperature sensor. In a parking lot, it was a 96-degree day, and in the shade, the earth was 96 degrees. But on the street, it was 135 degrees.
It's like basically an urban heat island. So we have all these buildings together, all that heat is trapped, and it has nowhere else to go. They've been doing construction here, and so there's not many, a lot of shaded areas, so we don't have many places to cool off. So having these benches here with some shading, I think it'll be good for the community.
Cool street structures could look like anything, which I think is a beautiful idea that, you can design things in a number of different ways, but cool streets are really looking at how you bring the temperature down in a specific location.
Why is this thing not walking now?
The future of Cool Streets is continuing to build, and there we're trying to be responsive to community needs.
We be so much in the house, so we need to go out.
It's something different que in the community, and the kids like it,
It's a resource that we can use, definitely. So hopefully, the kids will be able to utilize it and enjoy some of the summer.
Okay, our second panel today will do a deep dive on electrification, specifically how we build health and equity into electrification. We have a really super panel for this discussion. It's going to be moderated by Bomee Jung. Bomee is a principal at Topsight Advisors, and she's the former vice president for energy and sustainability at NYCHA. So Bomee, take it away.
Thank you, John. Hi, my name again is Bomee Jung, and I've been working at the intersection of affordable housing and climate change for the past 14 or so years, and as John said, most recently at NYCHA. As a houser, I'm equally concerned that we address the climate emergency quickly and effectively, and that we create housing conditions in which every person's dignity is amply supported. So it is a special pleasure for me to introduce this panel, many of whom I've worked with directly for many years. and all of whom are leaders right now in pushing forward this vision for climate action and climate justice. First, to introduce Donnel Baird. Donnel is an entrepreneur with a community organizing background. He's the founder of BlocPower, a startup rooted in and serving frontline and low-income communities with renewable and energy efficiency technology. Secondly, Ryan Cassidy is the Director of Sustainability and Construction for RiseBoro Community Partnership, where he oversees the operation of over 1,800 units of affordable housing in nearly 200 buildings. And Ryan has been the mover behind some of the most aggressive, passive house projects in affordable housing for the past decade or so. Rory is a public policy leader for many years, including serving as the New York State Energy Director for Environmental Defense, as well as the Director for Energy at NYCHA. He is also a newly confirmed member of the Public Service Commission, so congratulations, Rory. And lastly, Carrie Olson, Assistant Commissioner at the New York City Department of Health and Mental Hygiene, where Carrie directs a multidisciplinary team in health research, legislative and regulatory actions, and communications. She has been a leading voice in efforts to combat the health impacts of extreme heat. And that is through a multifaceted effort that includes healthcare system investment, community resiliency, and equitable access to air conditioning, as well as through addressing energy insecurity. So thank you very much for joining us for this panel. And I'd like to go straight into the first question, which is for Carrie. From your perspective, Carrie, as a public health leader, where do you see health and health equity intersecting with electrification and building performance?
Great. Thank you so much, Bomee. And I want to start just quickly saying that it is a privilege to take part in a conversation that is centering public health and equity as we talk about climate mitigation work and adaptation. So I want to start our conversation by framing the health and equity impacts related to residential building electrification in 4 main areas. I want to talk about positive impacts related to the intersection of housing and health, focusing specifically on heat-related health impacts, and also talk a little bit about air quality-related health impacts. And then I want to talk about some of the challenges as we think about energy insecurity as well as health impacts from power outages. So I'll start with the deep connection that we know exists between where we live and our health. And we know that systemic racism, including environmental racism, which Peggy defined in her keynote, and the related neglect has resulted in segregation of people of color into neighborhoods that have experienced decades of disinvestment. The resulting unhealthy built environments have in turn contributed to the health disparities that we've seen on display in the pandemic as well as elsewhere as we think about different health issues. So housing connects directly to health through multiple specific problems, and I'm going to focus specifically on the lack of temperature control in the summer. Electrifying our heating systems can directly impact a major adaptation that we need to address climate change in our city by increasing access to more efficient air conditioning. And the video that happened right before this panel is a great example of that. In the country and here in New York City, extreme heat events, heat waves, they're the most frequent and the most dangerous type of extreme weather. In New York City, on average, 10 people die from heat stroke each year, but another 100 die because of extreme heat worsening their pre-existing health conditions. We call these excess deaths due to heat. But the problem isn't limited to only extreme heat. The health department just completed an analysis of hot days, 82 degrees and over, which we know are increasing with climate change. And we found that 350 deaths every year can be attributed to the heat during the summer. Most importantly, though, is that heat-related illness and death are preventable. Most New York City heat stroke deaths occur in homes that don't have air conditioning. They're so hot that they are unhealthy. And we know that indoor temperatures can be much higher than outdoors, especially at night. And that heat indoors can continue for days after it has gotten cooler outside. So I'd like to ask that we pull up the one slide that we have, because I want to demonstrate that the heat-related health burden is inequitably impacting communities of color and low-income neighborhoods. So hopefully that will come up here in a second. On the slide, once we have it on the screen, you'll see on the left the New York City Heat Vulnerability Index, which Adriana mentioned in the previous panel, which measures the neighborhood level risk of heat mortality based on both environmental and social factors. The darker the color, the higher the risk. And on the right is access to air conditioning. Darker the color, less air conditioning. So even though when we walk down the street next to super cool businesses, it seems like air conditioning is everywhere, we know there are many New Yorkers that are living in hot apartments without it. Some of our poorest communities have up to 30% of residents who don't have air conditioning at home, and that's compared to only 1% in the wealthiest communities. So increasing access to air conditioning is key to taking a justice-focused approach to making our city more resilient to climate change. And then we also know that electrification of heating and cooling systems with the most efficient technology is going to provide us a path that can minimize the environmental impact while also saving lives. So I want to turn to a macro scale positive health gain from electrification in buildings, which is that as we phase out fossil fuel combustion, we're also going to see that there will be parallel reductions in criteria pollutant emissions. Improved air quality equals better or health benefits. And as was mentioned earlier, an exciting added benefit from reducing buildings emissions is that those reductions are occurring in the same place that people live. We conducted an analysis of the city's plan to reduce GHG emissions by 80% by 2050. And in that, we found that reducing the fine particulate emissions from buildings resulted in almost twice the avoided negative health outcomes as the same reductions from transportation. So focusing on buildings can really get us major health benefits. But we can't have discussions about electricity and electrification without directly considering the cost burden of energy for individuals. And this was also touched on in the previous panel about policy. Economic impacts from the pandemic have made this even more salient, particularly for low-income people and people of color in our city. The health department conducted a survey of nearly 2,000 low-income older adults last year, and we asked about energy insecurity, which is economic hardship in paying for utility services. We found that more than a third of respondents reported having difficulty paying for their electricity or gas bill. This is contributing to poverty, which is one of the most fundamental social determinants of health. So any health equity approach to electrification in residential settings is going to require advanced considerations of how costs are going to impact residents and making sure that electricity is affordable. And then last, but certainly not least, we have to talk about electrification from the utility grid using a health perspective. We know that power outages have their own health impacts. The 2003 summer citywide power outage that many of us lived through, studies showed that there were substantial impacts on mortality, on hospitalizations for respiratory disease, and emergency medical service calls for people who were using and dependent upon electric medical equipment. The health department has also done research and found that not only do the large power outages impact morbidity and mortality, but small outages can affect our health both in warm and cold weather. With better power outage data, we could further characterize the health impacts of power outages, which could help us better respond as we see those things. And one example, in 2019, there were planned blackouts in selected Brooklyn neighborhoods during the summer heat. And those were the same communities that were at the highest risk of heat-related mortality on the Heat Vulnerability Index. So as we think about increasing electrification in residential settings, we need to make sure that our infrastructure can both handle the increased demand, but also make sure that it's doing that equitably. And I know I went a little bit over, but I'm going to stop and turn it back to the panel. Thank you so much.
Thank you so much, Carrie, for those really comprehensive framing comments. I really appreciate it. So to you, Rory, you've looked at the intersection of housing and utility and energy policy for many years. How do these domains intersect for you?
Well, Well, first, thank you, Bomee, and thank you, Urban Green, for putting this together. Yeah, I want to reiterate some of the things said earlier by some of our keynote speakers, Dr. Allen and Ms. Shepard, because I think they made some very salient points which bear repeating. First off, on the subject of ventilation, the existing standards are acceptable. But we know that this ventilation standard isn't necessarily optimized for health, and what we consider standard may not actually be ideal. So looking at that from a baseline perspective, we look at low-income housing and low-income schools, and we know that they already have substandard ventilation when compared to what's deemed acceptable. So we have some major impacts occurring in these places that we need to address that can be addressed by improving the performance of buildings and how they relate to everyday occupancy. One of the points Carolyn made about heat waves being more frequent and having very significant negative health outcomes is directly tied to ventilation. So the better ventilation we have, the better we can address these other broader issues. So second, we also have to look at the housing policy that we have. The housing and energy policies currently in place don't prioritize public health at a local level. And we see that from the performance of low-income housing, poor housing quality that can damage health. And the federal government has done numerous studies, one of which from the Department of Health and Human Services, that documents that many low-income households not only lack air conditioning, but are often under-insulated or poorly insulated, leaving them either too hot or too cold. And that, as we know, is linked to some very significant negative health outcomes. Also, this makes individuals in these homes spend a larger share of their income on energy. They are energy burdened as a result. And keep in mind there are other factors as well. Mold growth can affect asthma. Overcrowding can create breeding grounds for infectious diseases. There are a wide array of factors that come into play that make the focus of low-income housing should be a priority in making it better. Low-income housing should not be synonymous with low-quality housing, and unfortunately, that has sadly been the track record. But when we look at the energy policies that we have, that in conjunction with how housing has developed, we see kind of a perfect storm. Not only is housing quality substandard lower for certain populations, but in many cases, our desire to build the system with affordability as one of the main guiding principles has meant building in areas where land is cheapest. That often means building in areas where low-income housing is predominant. Some have argued that this is a chicken and the egg problem, meaning that the infrastructure was built in cheap areas and low-income housing followed. But there are many points to illustrate that this is not the case. Close to home, Ravenswood, for example, on Vernon Boulevard, which is now Rise Light and Power, that was built in the 1960s. It was the largest power plant at the time. But it's just walking distance from what was then the largest public housing development, Queensbridge Housing, which was only built 30 years earlier. So we have a major development, low-income development, built on affordable land, and then just down the block, 30 years later, you build one of the largest power plants in the country. So this is a familiar track record that we see throughout, not just New York, but throughout the country. And we look today to address these issues by ensuring that whatever steps we take don't necessarily replicate the problems of the past. And finally, I want to talk about just kind of electrification broadly and what the different scenarios we're considering. What gets the most attention are typically the extremes. Many advocate that we should have a New York system powered entirely by 100% renewable energy. Others believe we should focus exclusively on deploying renewable energy resources in a distributed fashion, rooftop solar, battery storage, and the like. While others still make arguments about the condition of the gas system, that it should be shut down entirely. Each of these solutions has merit and can be examined based on regional and geographic needs, both to individuals and to ratepayers in the state as a whole. But whatever solutions we put forward, we need to make sure at a minimum they don't repeat the mistakes of the past, while also ensuring that we move forward and make sure those are affordable to all communities. and that the benefits of these investments affect all communities equally. The CLCPA does a great job of mandating a minimum 35% of benefits being targeted towards disadvantaged communities with a 40% goal. And I think that's a great place to start the dialogue and how best to achieve these goals. But in short, we have to recognize that the environmental impacts of power production and its effects on climate change don't affect all communities equally. And we need to put out the fires where they're raging, address the problems in communities that are disproportionately affected, while also ensuring we don't create other unexpected problems down the line. And time again, what we find, based on experience and evidence in other jurisdictions, we have to approach solutions with diversity in mind, not just where they're deployed, but the type of solutions that are deployed. And I think if we take an approach where we look at all the available options available, we can address some of the more significant issues affecting public health by improving housing and making the electric and power systems cleaner overall.
Thank you, Rory. Moving on to you, Ryan. So you deal with all of these very complex issues, most concretely in the form of having to make decisions about buildings, new construction and rehab buildings. So from your perspective as a developer who's done some of the most climate aggressive projects, including rehabs in the country, how do you think about the long-standing tension between housing quality and quantity of low-income housing? And how has RiseBoro arrived at striking the right balance?
Yeah, so our journey as an organization really started over a decade ago with new construction passive house projects. And, we were at that time, like many community-based development companies that are all over the city, just kind of building as per whatever the code was at the time, which, 15 years ago was from 1967. So not anything special about either us or our organization. We came into passive house projects through Chris Benedict, and we were able to develop and build passive house buildings at the same cost. And, we developed those buildings in 2012 and 2013. And so that gave us a real lead on the learning curve, I think. And that's what's positioned us well to move ahead. And then, of course, because RiseBoro is a community organization, we have lots of different groups within that organization that perform healthcare work. We ran a nursing home. We do lots of home care and things like that. So part of our model, business model anyway, is this intersection between health and housing. So as soon as we realized that we could build really energy efficient buildings at the same cost in the new construction side, we saw that it had value to our tenants and to our community. And so it was something that we were going to pursue and that we were going to really center in our developments moving forward. One of the first problems we had is really a problem that New York City itself was facing, that 15 years ago, vacant land in central Brooklyn was both available and probably, looking back, pretty cheap. Like the city in general, that land has all been mostly gobbled up. So we went from building a lot of new buildings to being faced with, what do we do with these 150 buildings in central Brooklyn that we own and manage, and we're committed to keeping affordable long term. So it's a similar problem that the city faced. And the way that we approached that was, well, we've got this passive house background in new construction, let's roll it out to renovations. So that being said, so that's how we arrived there, really. But I think your question kind of centers on the idea of cost. We've seen costs, and everyone in the development industry and construction has seen costs go up every year for any number of reasons, whether it's just general labor costs, whether it's requiring prevailing wage labor, which can add, 20 to 30% on a construction project. We've seen safety and fire department regulations change dramatically and add, millions of dollars of costs into projects. And yet through all that, we haven't heard any developer say, I'm walking away from building housing in New York City because it's too expensive. And yet when we talk about sustainability, there's this idea that, well, that's just a bridge too far. We can't build these super efficient buildings because they're too expensive. So we really just reject that premise on its face. We've got a really creative and dynamic industry that solves all sorts of cost problems. And the fact that we claim that we can't solve the one cost problem that actually benefits both operationally and really benefits our tenants, I think is a false choice. So we've always looked at cost as something that we can mitigate in a new construction environment. We think the cost adders are not substantial. There are cost adders in a rehab environment, but we handle them because it's important that we develop these types of buildings. So how do we get there? We center our passive house design. So we don't bring on consultants and other folks to kind of tack on sustainability onto our projects. Sustainability kind of is our project. And if you're not going to build an efficient building, then you're not going to build a RiseBoro building. So we center it, we don't negotiate it, and we keep it, it's a baseline in all of our construction contracts. And then we also recognize that, passive house is really a building quality metric. It's related to energy, of course, but it's got a lot of really good cascading benefits to both tenants and owners. So you get sound mitigation, pest control, moisture control through assemblies. If you're doing all electric buildings, you're eliminating really toxic cooking gases from apartments. You're eliminating water in baseboard heaters that's getting pushed all through your building and it's probably leaking. And you're improving indoor air quality with your ventilation. So we look at it, holistically. We've got a really great quality building metric, and we don't compromise it. So the last point is one on indoor air quality that's been especially prevalent. And again, being ahead of the curve has allowed us to sort of be always the one first in line when it comes to either grant opportunities or new challenges. So when COVID hit, we already had buildings that had dedicated ventilation that was filtered. We understand how the systems worked. We were ready to respond to them. So 2 years ago, we had started a program with MIT studying the before and after effects of a passive house renovation on our tenants. So we've been tracking indoor air quality metrics for 2 years with that team that's running all the data. And we're prepared to release results in about a year of what pre and post passive house looks like, which is really exciting. So really our goal here is to create healthier housing. We think that there's, the continuation of these benefits outside of just tenant health and operational benefits are really, lowering insurance premiums for owners, which is really important, and weaving in healthcare dollars into our affordable housing funding stack, which we think if we're showing these better indoor air quality outcomes and health outcomes, that should be our next step as an industry. So thank you.
Okay. Thank you for those remarks, Brian. So Donnel, so your company, BlocPower's model is, as I understand it, to aggregate customers and deliver affordable electrification at scale. So can you speak a little bit to how the imperative for health equity is manifested in that mission?
Sure, yeah, excited to be here and learn from all of the panelists. Certainly RiseBoro is doing incredible work, and it's great to learn more about how you guys approach that. I wish more building owners approached it in the same way. We used to think in building construction that it was fine to mix lead in our paint and paint it everywhere, and that was just fine, right? We thought nothing of it. And then 30, 40 years later, we realized that lead is horrible. It ruins the futures of our children, and it's unacceptable. So there's so many parts of buildings that are incredibly unhealthy. And right now we accept them as normal, but they're toxic and unhealthy and horrible, and they make our kids and families sick. And 20, 30 years from now, they will be unacceptable. And of course, as Rory and others highlighted, those health hazards in buildings are more prevalent in low-income communities, in minority communities and working communities, in particular communities that have been redlined, where banks would draw a red circle around different neighborhoods and if black people moved in or whatever in certain neighborhoods in Chicago, they refused to lend. So there was limited access to capital due to redlining or just due to a lack of financial services being available in these communities. And therefore, building owners, because they have limited access to capital, don't have the money to perform the sustainability renovations and upgrades and maintenance that can keep buildings healthy and energy efficient and productive and safe. Most buildings throughout America, and certainly most low-income buildings, don't have somebody, they don't have someone like Ryan from RiseBoro, who is a sustainability professional who can negotiate and understand from a technical standpoint what is necessary, what is possible in terms of making a building greener and healthier. You have to negotiate with contractors and architects and engineering firms in order to lower their costs or in order to push back or move them viable environmental sustainability project. Most building owners don't have that staff person that has that expertise, that sustainability professional that can argue with a mechanical or electrical engineer. And so, building owners across the country face a couple challenges. One, they don't have the technical expertise to understand the sustainability possibilities. They don't have the technical expertise to understand that you can decarbonize a building or electrify a building, and you can save money while doing it and reduce your energy costs, improve the health of your building while reducing greenhouse gas emissions. And you can actually save money while you do that. So most building owners don't understand that. And then second, if they do understand that, they have limited ability to access capital in the form of the tens of thousands or hundreds of thousands. Or I'm at a project in Westchester right now. It's $1 million project. We're decarbonizing and electrifying a church and a school in a low-income community or a moderate-income community. And it's a $1 million project. So many buildings throughout America don't have the ability to access that capital to pay for the sustainability upgrades up front. So our buildings are filled with lead and asbestos and mold. They funnel outdoor air pollution or produced from burning, coal or gas in the building and recirculated around the building. The ventilation systems don't work properly, and it makes everybody sick, and it's terrible. It's unacceptable, and of course, it's terrible for the planet as well as the health of our families. So at BlocPower, we found out a way to lower the cost of analyzing what's possible in terms of sustainability upgrades in buildings. And we work with our partners at Goldman Sachs and other places to finance the projects in a way that saves building owners money year over year so that we can make clean energy accessible to all. We've done that in 1,200 buildings so far in New York City. And right now we're expanding to 20 states across the country. And coast to coast, what we're seeing, there's lead, there's mold, there's asbestos, there's gas from stoves or boilers or furnaces. There's crappy ventilation systems. The buildings are health hazards. Super excited that the Biden-Harris infrastructure plan is focused on buildings, but even if they can't get the infrastructure bill through, we think that leaders in the private sector are going to be able to help building owners remediate these health hazards by moving their buildings to all electric, smart, healthy, green energy equipment. So excited to be here with all of you today.
Thanks, Donnel. So going back to you, Rory, are you, you spoke about, the decarbonizing the grid as well as electrification. Are there any unintended consequences that you're concerned about? And what will we need to do to make sure that we get this right?
Well, yes. Unintended consequences is an interesting way to frame it. I think there's the possibility of those happening. To Donnel's point earlier about, hey, it's a great idea to put lead in paint. Let's see how that works. And 20, 30 years later, we find out it's not the best idea. So I'm confident there will likely be unintended consequences. The future is hard to see. in part because the present is hard to grasp. And also when we look at our energy systems, both electric and gas, they're very intertwined. And I think about the future of electrification, there's going to be a greater dependence on the electric system. We're going to be putting more stress on a system that wasn't necessarily built to handle that level of stress just yet. And I think about that from the perspective of my time serving in Keyspan's T&D department. The various pieces of equipment that go into making the grid, the feeders, transformers, circuit breakers, relays, et cetera, they're all designed to operate under certain conditions. And through electrification, we're going to fundamentally change the nature of the grid, moving the New York system from a summer peak to a winter peak. But in doing that, that doesn't mean the summer peak disappears. It now means we have two peak conditions to deal with. Equipment needs to be maintained, and the more you use it, the more likely it is to be damaged, break, need maintenance, things like that. So ultimately, the more we use it, the greater the likelihood of potential failure than would happen otherwise. Now, system planners are incredibly good at planning ahead, but there are a lot of unknowns regarding the speed with which electrification will take place, where it will happen. There's some geographic considerations as well. But the key thing is, whatever we do, we need to make sure we maintain affordability. We prioritize equity considerations, as I mentioned earlier, and making sure that we don't repeat some of the same mistakes we've made in the past, and ensure that whatever steps we do take don't fundamentally lower the reliability and the safety of the grid that we have. So unintended consequences are a possibility. The best we can do is ensure that whatever actions we take can address the problems that are obvious and apparent, and things that we can deal with in the near term. So.
Yeah, thanks, Rory. In fact, I want to ask the same question to Carrie, but before I do, I just want to correct the way that I worded this, because, clearly things like, technical mistakes or whatever, we're not really, that's not what we're talking about here, right? And certainly redlining that's not unintended consequences. The consequences of redlining were the intended consequences, right? So let me rephrase that question a little bit and say, as we go through this transition, what do we have to make sure to get right so that we have a just transition?
Oh, that's much easier to answer.
Sorry, Rory.
No problem.
Revise your answer.
Well, no, the same does apply. I mean, all those things do need to be taken into consideration. But in terms of what do we need to do to ensure a better future through this process, we need to make sure that the buildings that we have, when they connect to the grid, are as efficient as they can possibly be. And we need to focus the attention where the buildings are currently least efficient. Local Law 97 is intended to do some of that, much of that actually, for a significant portfolio of New York City's buildings. But I think it may be a necessity to look beyond the city, looking in other places and make sure that investments can be made throughout the state to make sure the entire state's building portfolio is as efficient as possible. The transition towards renewable energy will require a significant build out of renewable energy resources. By being more efficient with the energy we need and investing in homes and making them more efficient, not only can we help improve the quality of life of the individuals living in those homes, but we may be able to reduce the overall cost of transitioning to electrification through more efficient means. So I think making sure those investments are made where they're needed most. Again, the 40% disadvantaged community target is a great start. And if we focus on that and do the work where it's needed, I think we'll move further ahead towards the goal than we would have otherwise.
Thank you, Rory. So to you, Carrie, as a public health professional, what do you feel we have to get right in the transition?
I think I'm gonna focus us back a little bit on individuals, which is frequently what happens when we think about the public health pieces, and double down on my discussion earlier about energy affordability. I think that as we're we're making these changes and really thinking at a building and system level, we need to be remembering how those costs get distributed. There's been lots of acknowledgement that this is expensive, but it must be done, and it can be done, and we can afford it. But we need to make sure that the burden doesn't end up sitting on the shoulders of communities that are already overburdened. I want to throw out there just one more statistic that I think is pretty important, which is that when we talked, or when we did this survey of individuals in the city, we asked them specifically about how paying their energy bills influenced other parts of their lives. And 3 out of 10 said that electricity, their ability to pay their electricity bills was affecting their health conditions. And 1 in 5 said that it affected their food purchases. So we know that energy insecurity is real. And so we just need to make sure that that's front and center as we think about these solutions. And then another thing that I just wanted to throw out there as well, I was really, it's so great to be on the panel with the experts here. And it's good that we're not talking just about new construction, but also rehab and retrofitting existing infrastructure, and just want to make sure it continues to be front and center, because we know that so much of the buildings that we have right now will be the same buildings that we have 20 or 30 years ago, or 20 or 30 years from now. So we need to make sure that our solutions are also thinking about how to deal with the existing infrastructure. I think those are the couple of things I want to throw out there. And then I also, at some point, it might be useful to talk a little bit about the reality of what it means for individuals and also health and sort of related for cooking. So we're talking about electrifying buildings, and what does it mean really when we're talking about people using, instead of gas stoves, switching to electric or even better stoves, that all sounds really great, but there's expenses involved, and then there's also sort of acceptability for individuals and changing what they do currently. So we know there's lots of benefits to be had, but we don't want those benefits to somehow be creating unintended consequences where people are cooking less at home, which can result in less healthy eating or these types of things.
Yeah, great, thank you. So Ryan, I wanted to ask you, this question is for Donnel and Ryan, but as private sector players, you're both involved in actually implementing electrification projects. And you're constrained by, I imagine, a number of things that are beyond your control. So, utility rates and regulations and such. So Ryan, would you speak a little bit to, what are some specific changes that could be made that would really unlock your ability to implement these projects at scale?
Yeah, I think there's 3 main sets of changes. The first is what Carrie was just talking about with utility rates. And, we have everybody in New York City, for the most part, pays the same amount for their electric, which means a lot to a person in an affordable housing unit. And it probably doesn't mean much to anyone else outside of, people that are financially constrained. So the first is like thinking about creative ways to deal with rates for people in affordable housing or people that live in highly efficient or all electric buildings. It's a good way to incentivize developers to build those types of buildings if you can give a rate break. The second is around utility allowances, which are kind of like a niche affordable housing thing, but it's important in the affordable world. And that's really, when you split the incentive and the developer and or the renter takes on the utility charge, what does the renter pay? So the rent is less if they pay their own utilities. It's more if the owner covers the utilities. So quickly you have an incentive for maybe developers to take on all the risk of usage because they have comfort that their buildings are going to perform. And that's the direction that we're headed. We're developing buildings now where we pay for everything, air conditioning, electric, the whole thing. The rents are a little bit higher, but it gives people a little bit more stability in terms of their charges. And then the third thing is really just the general policy. And that's, I mentioned at the beginning that when I entered the field, we were still working under a code from 1968. And that's since changed. And New York State has gone from saying nothing about energy efficiency to, being probably the leading state in the country with our energy policy. So we need to continue to do that and continue to pursue the stretch codes and push the city and the state to make those changes. I would again say that the folks that say that, you're going to impact real estate development, I just don't think you're seeing developers walking away from New York City because they have to make a more energy efficient building. So I think, that's the big policy stick, is really just continuing to be aggressive with our codes and generate better buildings.
Mm-hmm. So Donnel, same question to you. Are there specific changes that you think would unlock scale for you or for other contractors and innovators in the electrification space?
Yeah, I agree with everything that Ryan just said, and I would add, we think that there's $3 to $5 trillion of infrastructure capital that needs to be invested in order to make our buildings healthier and greener across America. 127 million, single family homes, 5 million small commercial and medium-sized buildings, and 250,000 skyscrapers or whatever. So it's a couple $2 trillion of investment that need to be made to decarbonize those buildings and reduce the 30% of greenhouse gas emissions across the country that those buildings represent, and the untold public health impact that those buildings have because they're poisoning everybody who lives inside them. I think that, we want low-income communities to own stock in the special purpose entities and holding companies that get created as that infrastructure money flows into greening buildings or infrastructure across America, smart, green, decentralized infrastructure. We want low-income people to literally own stock and shares in the holding companies that the infrastructure investments are made. Because low-income people will own portions of the infrastructure projects, whether it's energy efficiency, passive house, whatever, electrification, of course they're going to have ownership and governance. So working backwards from there, of course they're going to create jobs for themselves. They're going to prioritize the health of themselves and their families. With the use of the proceeds from these infrastructure investments. They're going to push for policies as people who own things do, as homeowners do. And so we want infrastructure to be owned in part by residents of the communities where that infrastructure is based. If we can base fossil fuel infrastructure in low-income communities, when we put green infrastructure and renewable infrastructure in low-income communities, we want low-income communities to own a piece of it and own a piece of the profits and dividends that are distributed. And that's going to help solve a lot of problems in terms of racial justice, working with disenfranchised communities while providing economic incentive for green infrastructure to scale. The other quick thing I think that's really important is we need an open source internet of buildings. And so for folks from NYSERDA, I know Rory's on the call, we need like a free open source buildings internet system that allows us to collect anonymized data on fossil fuel consumption and carbon emissions from buildings all over New York State. And we want all of our kids who are taking computer science 101 classes to work on that open source building system and just encourage a new generation of computer scientists to build software that's going to help to analyze and decarbonize buildings across New York State, instead of having this be a problem that's solved by like 2 or 3 different companies that have white collar engineers like ourselves, BrightPower, Cadmus, whoever. Like this needs to be wide open for software developers and mathematicians to help solve climate change in buildings and decarbonizing them at scale. So those are policy innovations that I think are really, really important.
Yeah, thank you, Donnel. All of you guys are saying things that, are so important and close to my heart personally. It's just such an honor to moderate this panel for you. So I want to switch gears a little bit and go to some of the questions that we've been getting from the audience. And so the first one I'd like to ask, I guess, whoever wants to pick it up. So the question is, if we wanted to decarbonize buildings and electrify buildings at scale, do we have enough workers available? Right? Maybe Ryan, you want to start with the state of the construction market today.
It's a good question. I mean, I think for electrification, if you're talking about air source heat pumps and electricians, I think the answer is yes. But there's more detail with facade and other trades that we could certainly always build out. And look, building out workforce is also a way to drive equity. And so, we should be building out a workforce that's more representative of the communities that these buildings are going into. So I don't think the industry is fully there, but again, the construction industry in New York is really robust, and they may not want to do certain things, but if given the opportunity and pointed in that direction by codes and other things, I think it will respond.
Yeah. Anyone else want to speak to this question?
Yeah, I want to amplify and echo what Ryan just said. When you look at it from the building perspective, New York has a strong industry in place of electricians, plumbers, tradesmen, you name it. Very strong union town. I think where there's going to be a growing need will be on the renewables side. In solar installers, offshore wind industry. These are areas of significant growth, which we already estimate will need significant labor to meet the demand that the state and the region is going to be setting. So I do think there will be a need for workforce programs to augment what we already have. And I also think we need to look at the work we're doing somewhat differently than we have in the past. What we're talking about with electrification in many ways isn't just we're going to electrify things. We're talking about making our buildings smarter, more efficient, more integrated. And that requires a level of attention to detail, attention to interconnectivity of different resources that we have not necessarily done in the building trade in the past. And I do believe there'll be additional training, additional needs that will need to be met over time to ensure that what we do with the buildings brings them in the direction where they can properly connect to the grid, properly benefit from all the advances that we're making, and be a resource to the grid, not just a burden to the grid in many cases. So I think the term was prosumer, turning a building from a taker of energy to something that can contribute back to the grid and making it more reliable and safer overall.
Right. So
I would just build on what Rory is saying, because I think it's so important. Like, we have to, and I'm an entrepreneur, so I can say things that he can't. We have to break some of the old models of construction processes. We need to train workers. They're going to need to understand internet connectivity. They're going to need to understand device interoperability, how to connect a proprietary software system from your electric heat pump to the proprietary software system in your smart LED lights or whatever. Like, they're going to have to be able to read air quality data, indoor air quality data from smart sensors. And they're going to have to be able to like hammer a nail and turn a screwdriver or remove lead and asbestos from a building. So this is a broad range of skills, right? They may need to be able to do some electrical wiring. And traditionally, you might have 7 or 8 different workers perform all those different tasks. We're going to need to train up workers who are like an army of one, who can show up and efficiently design and build the kind of decarbonization equipment installation processes that we need in buildings, while closing the digital divide, while impacting the health quality of that building. And so that's a new labor category, like as in the New York State Department of Labor has to create a new classification of workers that are going to be trained to do this work. The other part of it is, I'm a millennial. I'm an old millennial, but I'm a millennial. And we aren't entering the construction industry. Like, you may have a mom or a dad who's a plumber or an electrician. We're trying to be an influencer on YouTube. We're not trying to run our parents' electrical contracting shop. So there is this shortage of skilled construction workers overall throughout the country. And so what a great opportunity for those of us who are concerned about vulnerable populations, ex-offenders and returning citizens, people who age out of foster care. We can train and hire these folks to have good, great jobs with healthcare, making six figures on these technologies, installing and maintaining these technologies of the future that Rory was speaking of.
Yeah, great. Donnel, while I have you, we have this other question from the audience is for you specifically. Do you see problems that are, or issues that are region specific, or sort of are the issues that you see across the country sort of similar ones all the time?
No. We see, there's lots of differences. And so we're working with the city of Las Vegas. They have a year-round heat problem, right? Like lots of low-income people in Las Vegas don't have air conditioning, if you can believe it. As we all know, there's like a heat dome. Bomee, what are they calling it? There's like a drought out west and like this huge heating problem. Temperatures are projected to go up to 105 degrees in many parts of the American West right now. And so in Vegas, this is a particular problem because they have a public health issue because there's not enough air conditioning across the city of Las Vegas, particularly in low-income homes with senior residents. And so how do you provide air conditioning? How do you do so in a way that doesn't rely on hydrofluorocarbons? How do you provide efficient air conditioning? That's one problem. If you move over to Los Angeles and the Bay Area, San Francisco and Oakland, we have projects where really what we got to figure out how to do is install high efficiency hot water heating systems. That is the silver bullet that we need to decarbonize those buildings. But also traditionally, those buildings don't have air conditioning in the Bay Area because it's cool. As climate change increases, we're getting a lot of calls from folks in the Bay Area who are saying, my building has never had air conditioning, but every summer is getting up to 97 degrees because of climate change. Temperatures are increasing. So we're going to need air conditioning as well. And so you do need to focus on electric hot water heating systems. And I was with I shouldn't say who because it's not public yet. There's a heat pump manufacturer that's releasing a new electric hot water heating system, which is great and going to be really important out west and up through the Bay Area and, all over the country. And of course, in the upper Midwest, Chicago, the walls are extra thick because it's so windy that there's extra layers of insulation in all the buildings. And so as you run your heat model, as you move from region to region across the country, there's different kinds of packages of equipment that are necessary to decarbonize those buildings. And our job is, wherever you are in America, how can we make it simple and easy to understand and affordable for you to decarbonize your building so that you have a greener and smarter building? And so a lot of the things we're doing are building a map of all the buildings across the country, except for the skyscrapers. And we're working with Google to run models of how to decarbonize, millions and millions of buildings all across America. So wherever you are, you can just type in your building's address and there'll be an automated decarbonization plan for your building that makes sense for the type of building that you have and the location of the building that you have. And, oh, by the way, if you're in a community that needs environmental justice, we can figure out the extra cost of removing lead, asbestos, and mold and folding all of those costs into your building decarbonization plan. So we're learning a lot about the stuff, and anybody out there who's working on it, we'd love to hear from you. Super. Thank you so much. So I'm just going to ask one sort of last question, and this is sort of this is a total hypothetical. I'm going to give you a magic wand, right? And you can use that magic wand for, just making policies happen or making money show up or whatever it is that you want to do with this magic wand. But you only get one thing. So what is your one thing? So for example, I would say, I would want housing quality to be a primary consideration in utility policy, for example. That's my magic wand. Like, who wants the magic wand next? Rory, you want to speak to, what would you wave your magic wand for?
I have many ideas. However, I'm not sure if this is the right place or time to say them out loud. But I think, generally speaking, the magic wand would be used towards making sure that housing quality in low-income areas meets or is at par with those in non-low-income areas. Investing in housing, I think that's something we need to think through and do. Yeah.
Ryan, what would you want to wave your magic wand for?
I think I'm going to say the building code and just establishing a more aggressive target for building energy usage and just letting the industry react to that really aggressive endpoint.
Great. Carrie?
I think I want to I want to center health in the decision making that's happening for renovation of buildings, and as we think about the transition to electrification, so that really all of these different questions around that we've been discussing about how to both electrify and also do sort of more holistic changes are driven by, and we are measuring the health impacts and the health equity impacts of what's happening, so that we see the benefits and actually that they are being calculated and put out there in a very real way, so that people can see how we're also closing gaps in health disparities for the most burdened communities.
Yeah, great, thank you. Donnel, it's your turn with the magic wand.
Yeah, I mentioned it before. I want a free open source software system that allows us to analyze the health needs, the environmental justice needs, and the renewable energy potential of all buildings across New York State. The Obama administration had invested in an open source software system that we believe can do that. And we want New York State to embrace it and lead the country in deploying that free software systems to help building owners figure out how unhealthy is my building, how much can renewable energy save me money, what's needed in terms of addressing environmental justice needs in my building. We think that a free open source internet system can do that.
Yeah,
that's what I want.
Thanks, Donnel. So, it's funny to me that, I offered you guys that money like multiple times and none of you were like, well, what we need to do is spend $100K, per DU on renovations. I don't know if that means that because, we have such momentum that you think that the resources are coming, down the road, or that, we're going to make all of these things work out. But it's really interesting to me that the magic wand didn't materialize any money for us today. So I don't know if any of y'all want to comment on that.
I will. If we have the data on how to fix the buildings and how fixing the buildings will reduce public health costs and increase environmental justice and reduce energy waste, if we have that baseline of data, then capital will flow from the private sector according to where that data pinpoints and highlights, because that data will give us actionable investment opportunities for infrastructure investments to finance the green energy investments that we need to overhaul buildings across this country and make them greener and smarter and healthier. So I believe that as a premise, because I've now worked in the private sector for long enough to see that it's true. And so what we have now is a data problem and a workforce problem. And if we can solve both of those, the capital will show up and be there.
Anyone else?
Yeah, I want to.
Go ahead, Rory.
I want to echo Donnel and also point out, the data likely exists in lots of disparate places. I know Department of Energy is putting together a building database, and that's probably what you were referring to earlier, Donnel. And I've had some conversations with them about that, how that could be used for select portfolios in the city. But I do agree, merging that with public health data and other information, however the disadvantaged communities discussion settles out, I think will play a role in that as well. I think that would be a great start, because we want to make sure we make investments in a smart way in an effective way, in a way that ultimately leads to the best outcomes with the least amount of spend. If money was no problem, we could do everything, anything, anywhere, anytime. But that's one of the bigger constraints in what we can do. So we have to identify the places where we can get the biggest bang for our buck and start there and do the best we can from that point on.
I would just add quickly that very yes and to those points, in that I think that we have to also consider how do we make social costs, like those public health costs, real in the spaces that are actually making these changes in the industry, et cetera, which I think is a real challenge. So we need to continually be thinking about how to make those costs felt in the places where the industry is happening.
Great. Ryan, did you want to jump in with any last response to that?
Yeah, I agree with what's been said. And I think if we compel the industries to just reach a standard, that the capital will readjust itself to, go where it needs to go. If we center these problems and say that they're not choices, but mandates, a lot of those capital issues will work out the way that we've seen on our little projects.
Great. Well, thank you so much to all of you for joining me for this panel. I want to also thank Urban Green for the opportunity to have this conversation. So thank you very much. And I guess back to you, John.
Thank you, Bomee.
Great. Well, thank you, Bomee. Thank you to the entire panel for that absolutely great discussion. Well, we're at the end of our program today, and wow, we're so grateful at Urban Green for the discussion by all of our speakers. We're so grateful for all of your participation at our conference. I want to send out a big thank you again to our sponsors, Carrier and Danfoss, for helping to make it possible. I hope through the course of today's conference, we all found a new lens to view climate, equity, and health together. I know I learned a lot of new questions I should be asking to be avoiding those false choices. Questions that I learned today, like, is the decision table really inclusive? Do we have the right metrics? Are we thinking about the right ventilation standard finally? Are architects and engineers ready to be the healthcare workers for buildings? Is equity and environmental justice being factored up front and not at the end looking back? Will cleaner energy be affordable enough? And finally, how is social science meeting building science? I hope you formed your own questions to ask so we finally lose the false choices of the past. So thanks again for joining us. I hope to see you at a next Urban Green event. And that's all from Studio Urban Green today. Stay safe and stay well.